Have you ever wondered how your brain can know you're safe, but your body still reacts like you're not? If you've heard of EMDR, you might be thinking, is it legitimate? Is it safe? Do I have to relive my trauma? Today, I'm answering the top 10 questions people often ask about EMDR. I'm going to be using peer-reviewed research and major treatment guidelines so you can make an informed decision. Number 1. What is EMDR? EMDR stands for eye movement desensitization and reprocessing. It's a structured psychotherapy originally developed for trauma-related symptoms and is now one of the most studied trauma-focused treatments. One of the earliest controlled studies was published by Francine Shapiro in the Journal of Traumatic Stress in 1989. Number 2, is EMDR evidence-based? Yes, EMDR is included in major international guidelines for trauma-related conditions and PTSD. For example, the World Health Organization recommends trauma-focused therapies, including EMDR, for conditions specifically related to stress. And the International Society for Traumatic Stress Studies, or ISTSS, includes EMDR in its PTSD prevention and treatment guideline recommendations. Number 3, how does EMDR work? What's with all the eye movements? Great question. EMDR uses bilateral stimulation, so both sides, often eye movements, but can be taps or tones in your ears, while you briefly focus on parts of a memory and what it means about you or the world now. One line of research suggests that eye movements may reduce how vivid or emotionally intense a distressing memory feels during reprocessing. A meta-analysis examining the contribution of eye movements found they can have measurable effects on emotional memory processing. Number 4, do I have to tell the details of my trauma? This is one of the most common fears, and in EMDR, you typically identify a target memory and what it triggers: image, a belief, emotion, body sensations, and you can share details, but EMDR is often discussed as a therapy where clients don't necessarily have to describe every detail out loud in order for the work to still be very effective. If you're worried about this, a good EMDR therapist will explain how they handle pacing, consent, and what you do or don't need to verbalize. Number 5. What does an EMDR session actually look like? Most EMDR treatment includes history taking and planning, preparation, equipping you with coping skills, grounding and stabilization, targeting, identifying the memory, negative belief, and the desired belief that you'd like to have instead, processing with the bilateral stimulation, closure, so returning to the present and giving you the resources that you need to leave the therapy room, and reevaluation of the next session, whether we need to continue reprocessing or you need some more preparation, or if you're ready to move on to something else. So you're not just moving your eyes for an hour every single session. It's a structured process that every EMDR trained therapist should be using. Number 6, is EMDR only for PTSD or big T trauma? EMDR has the strongest evidence and guideline support in trauma-related conditions like PTSD. Clinicians also use EMDR-informed approaches for other distressing experiences, but the most robust, widely cited evidence base is, of course, for trauma symptoms and PTSD. Number 7, is EMDR safe? Can it make me feel worse? Any effective trauma therapy can temporarily increase emotion during the process. That's why we provide grounding and stabilization practices. Consider pacing so important. Because you're activating that distressing material, it's going to bring up those emotions. All of that said, clinical guidelines emphasize trauma-focused therapies delivered appropriately, and quality EMDR includes that preparation phase and attention to safety and stabilization. So if someone has significant dissociation or unstable substance use or is currently in ongoing danger, an ethical clinician will carefully evaluate whether they're ready for EMDR and adapt the approach to suit that situation. Number 8, how many sessions does EMDR take? There is not one universal number. It really depends whether it's a single incident trauma versus complex developmental trauma, what the current stressors and supports are available to that client, stability, dissociation levels, overall health, and whether you're working on one target or many. Guidelines support trauma-focused therapies like EMDR, but they don't promise one session cures trauma. Be cautious of anyone that ever sells you on something like that. Number 9, will EMDR erase my memory or change what happened? No. EMDR is not about deleting your memory. The goal is typically to reduce the distress, the reactivity, the emotionality connected to the memory, and to shift the meaning you carry along with it, like going from "it's all my fault" to "I survived and I have choices now." You keep the facts of the memory. What often changes is the intensity and the stuck trigger or alarm response that you get. Number 10, EMDR versus CBT, which is better? Both are evidence-based, trauma-focused options, and different people respond differently. Some reviews and meta-analysis compare EMDR and CBT approaches for PTSD symptoms. One meta-analysis found both EMDR and CBT can reduce PTSD symptoms, with differences varying by study and sample size. The most important predictors of a good outcome often include a well-trained therapist, a strong therapeutic relationship, the right pacing and fit for you, and using an evidence-based aligned approach with your needs, and using an evidence-based approach that aligns with your particular needs. So those are the top 10 EMDR questions answered with what research and guidelines can actually support. If you want, I can make a follow-up video on what being ready for EMDR means or looks like, and what preparation looks like, and how to find a clinician with appropriate training. If this was helpful, like and subscribe, and drop your next EMDR question in the comments.